So Dr. Lavallee, I consider a pioneer when it comes to really putting a voice for cultural safety, when it comes to doing work with First Nations communities.
When I think about the work he did during the pandemic, I think about how he used his in-depth knowledge of Indigenous health to understand what needs might be beyond the things I was thinking of as a public health physician or that the system might have been thinking about.
The biggest challenge is that the current healthcare system was never made to advance health and healing for First Nations or other Indigenous peoples, full stop. Okay, it's not broken for us, it's just never been aimed at our bodies. And one of the biggest challenges is to get people to think of us not in stereotype, but to think of us as equally human.
So today is an extraordinary day, and as a Grand Chief of MKO, I want to blanket Dr. Lavallee for all the work and commitment that he has done. And it's my honor to wrap around this blanket to him because it's one of the greatest honors that we do for our people.
Everything that I've done and do, for community people has really been based on justice, based on equity, and based on holding the systems of white supremacy accountable to what doesn't happen to my community members. And that has been like a huge, huge journey for me of learning and articulating.
He is always asking us to consider how underlying racism is impacting the systems and thus First Nations people, and through those questionings developing different responses.
He's well before his time, but I think his legacy will be that things are changing in our system for the better. And I think there's a whole generation of non-Indigenous but also Indigenous physicians and healthcare workers that can really stand upon the shoulders of a giant who's been pioneering in his work.